Well, back with Dr. Riopelle. Dr. Riopelle, tell me, there's a lots of teenagers and young people who they get acne and well they don't like it. Is there any way to prevent acne at all?
Well, definitely. We have many solutions available for acne nowadays, going from anything along the lines of creams to apply to the skin, to acne pills, to even special lights that we can shine at or flash at the face to reduce the acne, and special medications that we can put on to make the acne go away, followed by a special light.
Okay. Well, you did mention now acne go away, and I kind of mentioned preventing it to getting it in the first place. I mean, is there a fine line in between? Tell us a little bit.
Well, in the true respect, all acne treatment, except for two things, is preventive. For example, when you apply a cream to the face or even take an antibiotic for acne, you're not getting rid of the acne that's there. That acne is going to go away on its own over time, and new acne would normally come along if you're not treating it. There's about a 3-month cycle for acne. So when you're putting on a cream or doing most things that are available for acne, it's to prevent the acne that's going to be there in 1, 2, 3 months, not to really get rid of the acne that's there at that given time. So yes, we do have many things available to prevent acne. Even if the acne's there already, we're preventing it. So if one starts treatment early when the acne is in very mild stages, you're really preventing the acne that's coming 1, 2, 3 months later. Does that answer your question?
It actually does. It actually does. And do you think that your new hyperbaric chamber, which gives basically lots of more oxygen to the blood flow and thus has wound healing, and I think an open acne pimple is a wound, in my opinion. I don't know whether it's medically. Do you think that could have a positive effect to it? Have you seen some results there at this moment? I know you got the machine just very recently.
Yes, I really don't have enough experience that I can answer that question yet regarding acne treatment.
Okay. But theoretically, it being an open wound to a degree and it being FDA approved for wounds, and that's for wounds is what you got. Do you see a good future for it? Do you think it could help? Will you try it?
I really can't say for acne. I'm sorry.
Well, all right. I got it. Well, okay, but basically acne can be prevented, and whatever you have goes away in a couple of months, more or less anyway. People just don't realize it because by that time, like mushrooms, a new one came up.
That's exactly right. And with the exception of 2 treatments, we have 2 treatments available here in the United States that actually get rid of the acne that's there already. One of those is something that we do very frequently in our office called photodynamic therapy. With that treatment, we apply a medication called Levulin to the skin, and then we let it soak in for an hour, and then we activate it with a light, with usually a photofacial or intense pulse light, it's called. And what that medication does is it changes the glands in the face so that they function more normally. That's probably what you're hoping will happen with the hyperbaric chamber. And as I say, I just can't comment. I don't know at this point. Too early to say. But we do have this other treatment available. When we apply it to the face, it makes the glands more normal. And as the glands become more normal, the acne gradually goes away and stops reoccurring. So that's a great treatment that we have for prevention of acne, and we do that all the time. The other treatment is Accutane. Accutane's a commonly used medication here in the United States. Has some potential side effects, though, that make it a little more complicated to use than the photodynamic therapy, though.
Wonderful. But there are actually treatments out there. It's not like you get it and you have it and there's nothing we can do. There is something which can be done about acne.
Oh, absolutely. When I was a teenager, I had some pretty bad acne. And at that time, the treatment was not that great. I'm 54 years old, so, we're talking about 40 years ago. My children, though, all of my children are teenagers. They're all on acne treatment, and none of them have any acne at all. I mean, they've stayed on the acne treatment from the age of about 13 to about, my oldest daughter is just 19, and she's finally getting off it because I think naturally she doesn't have it anymore. But Absolutely, we can do great things with preventing acne. I mean, no one should have to walk around with any acne at all with the treatment we have nowadays.
I love it. And I'm sure your daughter and your son love it also to have had a good, clean face during those so important years.
Absolutely.
Great. Well, thanks a lot for letting us know. And, the message to people is something can be done for acne. Just go to a dermatologist, go to a person who knows what he's doing it. Stop fiddling with the over-the-counter stuff alone. Just go and get the real treatment, and you'll get the real help, I guess.
That's right. Exactly.
Thanks a lot, Dr. Riopelle.
Oh, you're welcome.